Convention Center. This can only mean one thing. The Health in 2.0 wrap-up edition of Health 2.0.
No, it's
yes,
the
it
Health
is that.
2.0 wrap-up edition of Health in 2.0.
That's what I said. That's what I said.
No, you didn't.
Shush, that's what I said. You listen back to that. Tweet, people, tweet. I got that right. Team Jess. Hashtag Team Jess. Okay, so.
Team Matthew.
Nobody is on Team Matthew, not even Matthew. Okay, we've tested this before, somewhere in like episode 30 something, and Team Jess always wins. Thank you, John Lynn. All right, so Health 2.0, the 13th Health 2.0.
No heckling.
Well, there was a little. I'm heckling now.
Post-game heckling.
I have a lot of questions about what went on, and I'm sure people out there want to know. So, do you have your timer ready?
Oh, it was a mystery timer.
We have a timer hand.
All right, why don't you hit it?
I love it. Only here at Health 2.0. Is it going? And here we go. Big moment. Jonathan Bush reappears in healthcare on the Health 2.0 stage and talks to you. This is what he does first. Why? How bad are things?
Well, they are like fireflies on stools.
Oh, that's a terrible joke.
It wasn't a good joke, and I made it again. Okay. So he's back. Firefly Health is a doctor's virtual care, yet another primary care entry. As he pointed out, even if they and the other 8 big companies in primary care do really well, they're not going to be even a big dent in the US primary care market. There's so much opportunity to fix. We also had Tony Miller from Bind Health, who's another vigorous free market guy who's going to fix healthcare guy on my insurance panel, saying similar things. So I really enjoyed those two. Jonathan was quite hilarious. He was a little bit rude about me, the conference, HIMSS, everyone in healthcare, but he was nice to Glenn Tillman. Who he hasn't been nice to ever in his life, and vice versa.
It's a whole new era.
It's a whole new era in healthcare.
All right, so tell me everybody who won everything important here at Health 2.0. Let's start with the Robert Wood Johnson Foundation Challenge winners.
All right,
so
the
social determinants of health challenge, and also the Home and Community Care.
All right, we'll
challenge.
start with the Home and Community Care Challenge. 114 entries. It was up there. 97 entries. That one. Really good. One somewhat surprising by a new thing called Prehab Pal from a tiny company called Ooney. Emily Finlayson, who's a surgeon at UCSF, and Sean Baumgartner, who's a techie guy, put it together, and it's a way to, if you do prior to surgery rehabilitation work, you get much better results than surgery. People realizing that surgery matters, that what happens before and after surgery matters, not just the surgery itself. Okay. Second thing was the community, the social determinants of health, and that was won, believe it or not, by a company called Social Impact AI Lab, which is another conglomeration. This one with a guy called Marty Alisco.
Thank you, timer hand.
Marty Alisco from Augmented Intelligence, and Bess Abouter from Mercy First, and they had a thing where they pulled out data from information from social workers for their case notes to be able to highlight them so they can be more effective and efficient in treating patients, people with incredibly vulnerable family issues. So
okay, so the question was, tell me everybody at Health 2.0 who won things. So I believe we can keep going because I had asked it before the buzzer.
Oh, so I'll keep going.
Who won the launch thing?
The launch was won by Omni, which is a quite well financed and rather cool system for getting information out of hospitals and what they're doing with their supplies and their drugs in order to resell them back to drug companies. Right now that information is gotten in a very expensive way, and they've got a sort of cool way of taking it out of the hospital system. And there were some other cool players in launch as well.
Okay, no, but they didn't win.
Okay.
And then who won for your most favorite session, or panelist, or presenter that you saw here at Health 2.0 this year?
We sounded different.
The big winner.
This is the ongoing thing. So I think the best one of the lot.
Matthew Holt's pick.
My whole pick was Indu Subaiya's Unacceptables panel. Had 2 amazing people on it. I had several amazing people on it. But perhaps 2 of the most amazing was Melissa Hanna. This is CEO of Mahmee, spelled Mahmee.
Yep.
Mahmee is a new system for putting mums and their kids' birth records on and managing and coaching them from sort of before birth to after birth. Serena Williams, Mark Cuban, amongst Backstage Capital, Olive Hamilton, I think is the CEO of that, all invested in that, really super cool. And she was on stage with an amazing woman called, whose name I'm going to forget, remember, I'll read out, Joia Crear Perry, who is from the National Birth Equity Collaboration, wore a t-shirt saying Black Births Matter,
awesome.
and she gave us some amazing information about the crisis in mortality for African American women around childbirth. So they were absolutely amazing. If you had a chance to see them anywhere, follow up with both of them.
Awesome. Great
So
job.
I spent about 7 minutes on.
Well, what else is new? You get like longer and longer and longer every time.
Calm down.
No, but it was a great conference. I think everything went really well.
So
yeah?
Jess, what do you think about your panel? Can I ask you that question? Because you had a great panel with a bunch of social impact people on as well.
Thank you. My panel was lovely. So we were talking about different social movements in healthcare, and so we talked about data privacy and the fact that there is no social movement in healthcare around that, so people need to mobilize. We talked about diversity in investing, and so we had Pamela Johnson from the American Heart Association talk about that, and then we talked about
Open notes, which actually has been successful.
Yeah, it's gaining some traction. And then last but not least, we have what is it? Time's Up Healthcare, and so stopping sexual harassment in healthcare, which is rampant. Some of the statistics in there, Jesus, like 75% of like all female doctors report being sexually harassed at one point in their career. Terrible.
I think it was 55%, but it's still pretty damn bad.
No, I'm pretty sure that was 70. Okay. Anyhow, yeah, good panel, great conversation.
You did it. No, you did that really well. I was very impressed.
Thank you. I'm mad I didn't win your favorite, but I understand. All right, guys. If you want to find out what else happened at Health 2.0, you can of course go back through our Twitter feeds and stalk us. I'm at Justin Massa. He is at Bolty Boys. Be sure to sign up to make sure that you never miss an episode of Health 2.0. Subscribe to our YouTube channel or simply sign up for our e-newsletter on the healthcare blog, thehealthcareblog.com.
And we'll see you from another conference soon.
Speaking of the healthcare blog, time out. We're going to shout out our special timer hand and also our cameraman, or camera woman, we should say, the editorial team from the healthcare blog, Zoya Khan, our editor-in-chief, and Christina Luke. All right, thanks guys. We'll see you soon.